A new batch of COVID-19 vaccines will arrive today, while Metro Manila and four other areas are under the strictest lockdown, and the health department records another all-time high number of cases. Now, what will the current ECQ bring to stop further transmission? We discuss in this episode of the Chiefs. Welcome to this Monday edition of the Chiefs. With us, of course, tonight are Robbie Alampay of One News and Luchi Cruz Valdez, the head of News 5. Robbie, Luchi,
Good evening, Robbie.
Happy Holy
Good
Monday.
evening.
Happy first day of ECQ.
Yeah, and first day of
first day of
10,000
ECQ and codes.
First day of 10,000 mark.
First day we breached 10,000. Yes.
10,000. Well, walang masabi.
What's your top story, Robbie? From the big story.
Let's start with something light. May pag-asa. May pag-asa ang Ever Given. They finally partially refloated the Ever Given.
Ang layo ng hugot mo.
Hindi, but I want to start with something. I want to start with something positive. No, but seriously, this has big implications also worldwide. You know, people have been making memes about this, but this is really big news because if we can get this moving, it helps a lot of the economies, global trade to keep moving. And isipin nyo, meron ding mga vaccines doon headed for particular different regions in the world. So that really is one of the big news that we're looking at today. It's been partially floated, pero hindi pa talaga na-unclog yung Suez Canal. Nadiretso na, pero hindi pa pinapadala.
Bakit? I mean, can't they swerve?
I think if I am understanding the news correctly, they're just making sure that kasi ilang araw ding nakastuck yun doon. So making sure everything is right with the ship, if not for that matter, the canal, to make sure that everything is right.
Oh, okay. Yeah, but
kung Pilipinong nandun, marami na nagka-counterflow doon ngayon.
so talaga, I'm sure baka Filipinos ka nagmaman nung ship.
Ay, hindi. Wala. I was curious about that. Walang Filipino crew. Walang Filipino crew. South Asians primarily. Indians, if I read that right.
I see. Yeah. But I mean, it's amazing how big it really is, no? For it to actually block the entire canal. It's fantastic. Anyway, so talaga, tama na yan. Okay, let's...
the canal's not even very big.
I'm glad that we're making light of this, but our situation now is nothing but, right?
Yeah.
We're in a really, really tight bind. And, you know, we have a lot of questions to ask our guests, so let's get the ball rolling.
Okay. Let's bring in our first guest for tonight, Health Undersecretary Maria Rosario Vergeire, the spokesperson of the DOH. Usec Vergeire, thank you for joining us and welcome back to Chiefs.
Good evening, Usec.
Good evening, Usec.
Ay, wala pa pala. Sorry. Okay. Banter daw muna. Okay. Back to Ever Given.
Sige, pumunta na tayo dito. 10,000. Huwag mo na sayangin yung segue.
May good news si Okta, si Guido. Ginas namin si Guido David sa SPL kanina just for this program. Yeah. Well, sort of good news. Sabi niya, remember the previous projection of Okta was 18,000 by mid-April.
Right.
We're certain not to reach that anymore. Kung sana baka nasa 13 lang ang mid-April natin.
Why?
Yeah. So you're looking for good news?
What that was right? Was it the ECQ? Pero
kasi the mid-April projections were way before even the Metro Manila bubble.
That's right. And remember yung lahat every time. No, and also remember, every time magpo-project ang Okta, it is always premised on kung ganito yung sitwasyon at walang magbabago. if this is so when they made that projection, it was at least 3 weeks ago, di ba? So walang ECQ, walang stricter lockdown, walang bubble, and so on. So all their projections are always based on if nothing changes from the situation right now.
But so far, they're on point, right? Because they did say that by the end of March, we would hit 10,000 a day. And we did. I mean, it's not even really, strictly speaking, the end yet. But yeah. So, but I'm glad. That's really good news. I'm glad.
May warning din siya for this coming Holy Week. There might be some movements in the numbers that are artificial. Kasi for example, di ba, normally Thursday, Friday, Saturday, patay na araw yan eh. Kumbaga, walang pumapasok at all offices are closed eh. So malamang even the testing centers are going to be closed. So you can expect 3 days na walang testing, walang results. So babagsak artificially yung numbers mo.
Tapos, bubulaga na naman pag after
to that event. It did. Yeah, bubulaga. So if you're not cognizant of that, na the artificial yung pagbagsak ng numbers, baka mamaya mag-loosen up ka ng prematurely.
But Bok, does that mean there will also be an artificial spike for at least 1 day?
I'm sure.
Yes, that's also going to happen.
Maybe not just even for a day, no? Because they're going to be closed Thursday, Friday, and then balik na lang Saturday. But that's 2 days. Plus, ako naman parang feeling ko, it's not a good idea to stop that even for a day, because this is what we need to be doing right now. Diba? We should be testing, and we should be tracking, and we should be really, every step of the way, we should be monitoring, managing. Diba? But to take a break now, parang medyo, that's weird.
Well, I don't know, but I think ang assumption lang ni I think ang assumption done is not just whether or not laboratories will be open or closed. I think they're also factoring in how people behave during Holy Week. I guess kung serious ka talaga, if you're symptomatic, you're serious, one way or the other, you will find your way to the hospital. But there are also people na, one way or the other, for one reason or another, kaya nila mag-decide and rationalize to themselves na ipagpaliban ng testing. Diba? So yun din ang lalo na sa Holy Week, the people, and probably that's going to be factored in. But I think the point is that I think it's a reasonable assumption on the part of Okta, and they're just flagging all of us. Pagka po bumaba, do not assume that everything is better.
That's artificial. Yeah, kasi they saw that nung Christmas. And in the Philippines, mas hindi pupasok yung tao pag Holy Week kaysa sa Christmas. Diba? Walang tao pag Holy Week. Walang sila pag Holy Week. Pag Pasko pa nga, meron eh.
Yes, that's true.
Parang nagpaparinig ka, Boka. Parang nagpaparinig ka sa mga boss.
Wala.
Wala naman talaga eh.
Kahit Pasko pumapasok.
Andiyan yung guest natin. Andiyan yung guest natin. Moving on. Sige. Well, our guest is already here with us. Health Undersecretary Maria Rosario Vergeire joins us. Usec Vergeire, thank you for joining us.
Yes, good evening, Usec.
Magandang gabi po.
Good evening po.
Good evening.
Good evening po. Yes, ma'am. Ma'am, we were looking for some spot of good news amid all the numbers that we've been seeing. And well, I suppose you can say that it's a bit of good news that you said a while ago. Na mga 430,000 ang projected by end of April kung hindi tayo nag-ECQ. Pero nakapag-ECQ tayo eh. So we suppose with that, you expect the numbers to be improving. We're wondering by how much po yung tingin yung effect nitong pag-ECQ natin dun sa earlier projections ng DOH.
Well, we're very much hopeful, no, na this ECQ would provide us that time for our health system to breathe, for our health system to be able to manage the current increase in the number of cases. And ang katulad nga po ng faster projections, ang sabi nila, if we're not going to impose any strict restrictions immediately, will reach up to about 430,000 cases by the end of April. Pero kung magbibigay tayo ng mga ganitong stricter restrictions, we will be able to maintain itong ating current active cases of about 105 to 110,000. Ngunit syempre, kapag marami pa ring factors na kailangan natin tignan sa ganyan, dito bang sa ECQ na ginagawa natin ngayon, magagawa natin yung objective natin of why we did this, no? Were we able to augment our hospitals as to the resources that they require? Were we able to enhance and be able to organize our referral system? Nagkaroon po ba tayo ng strengthened na response sa local governments? All of this has to be factored in order for us to see if there would really be an effect as based on this ECQ that we did.
Okay, now ma'am, with that po, temperature check tayo sa
Okay, sorry. The question foremost in the minds of Metro Manilans and those in the NCR bubble, of course, is whether this ECQ will be extended. What is the likelihood that it will be extended?
Well, kailangan po natin maintindihan, in this 1 week that we will have for this ECQ, we won't see any changes in the numbers, or we won't see any changes in the utilization rates in our hospital. This is so short a time for us to do that assessment and have that effect. And we know that there is this 14-day period of incubation for our individuals with COVID-19. So hindi po natin yan makikita. So ang magiging basihan po natin if we are going to extend or not, medyo nagkaroon na po ba tayo ng augmentation dito sa ating mga ospital? Naiayos na po ba natin yung referral system natin? Nagkaroon po ba tayo ng step-down care facilities para matanggal natin yung mga mild and asymptomatic sa ospital para makahinga ang ospital? Ang local governments po ba ay nadagdagan yung kanilang pag-iigting ng kanilang PDITR, doing the code strategy, doing house to house? Kasi kung nagawa po natin lahat yan, and then we can say that even if we lift some of the restrictions at hindi tayo mag-ECQ, tayo ay kaya natin, we can accommodate even if the cases will rise because our system will be more ready.
Ma'am, doon po sa isang nabanggit nyo, kamusta nga po ba? Temperature check tayo sa public health system natin, both in terms of the capacity of our hospitals at saka yung vaccination program sa ating frontliners. Kamusta na po?
Yes, when it comes to hospitals, if you would look at our healthcare utilization rate, makikita po natin sa buong bansa we have 63%, no? And ibig sabihin yan, you have 37% available. If you zero in on the National Capital Region, meron tayo about 70% na utilization, meaning may 30% pa. Pero what would be most important that we are looking at right now would be our ICU utilization. At pag tinignan po natin ang ICU utilization, especially here in NCR, we are at that critical risk already. Aside from that, tinignan din po natin yung emergency rooms natin at nakita natin talaga overflowing ang mga pasyente. Kaya nga po sabi namin, we have to impose this restriction right now nung time na nag-recommend tayo, or else we will really get overwhelmed already. As to vaccination, we had been able to vaccinate already 63% of the targeted master listed healthcare workers na binigyan natin ng initial first dose. Actually, for today, nag-umpisa na po yung mga nagsi-second dose. And every day naman, nadadagdagan tayo, and we will do simultaneous vaccinations already. We started last Sunday, kahapon po na nag-announce na, nag-umpisa na rin ang local government. So hopefully, this measure also we can add to the protection for the individuals in the population.
But you're talking about just the whole country na. But if we're talking about just NCR, is the number still the same, 600,000 of health workers already vaccinated, or is that for the whole nation?
Actually, this 63% would be the whole nation. But if you look at the National Capital Region, mas mataas po ang ating porsyento dito. Dahil mas madami po tayong naibigay na doses dito sa National Capital Region, mas mataas po ang kumpiyansa ng ating mga healthcare workers dito. At dito po tayo nagkaroon ng focus talaga sa pagbabakuna based on our prioritization framework. And also, in the different local governments, we will hear anecdotal reports for today, no? Because we have not consolidated the report, na talagang marami na pong nagpabakuna even for senior citizens and those with comorbidities.
Ma'am, yun po bang mga pasyente na nagpapahospital?
Ma'am, a while ago you were talking about...
Go ahead, Ed. Go ahead, Ed.
Oh, sige. Ma'am, a while ago you're talking about making decisions on whether or not to lengthen the ECQ based on several factors, whether meron na augmentation dun sa hospitals, whether step-down facilities are already in place and all that. I'm wondering lang have you done benchmarking? Kumbaga, where are we now as far as those are concerned, and what targets are we looking at least by the end of the week to see if we are meeting those targets?
Yes sir, no. So isa po sa instructions ng IATF nung kami ay nagpulong nung Sabado, ang mga officials natin instructed us there should be this local government scorecard para po dito sa indicators na
Mhm.
kailangan nating bantayan ng maigi ngayong linggo na ito at sa mga succeeding weeks. Unang-una, nandyan na po yung ating surveillance systems, no? Kailangan meron silang functional na sistema na ganito. Pangalawa, contact tracing efforts, very important pa rin po. Hindi lang po yung numero nung kanilang natitrace, pati rin po yung those contacts traced within 24 hours na na-identify mo yung positibong individual. Very critical. And also another critical indicator would be of these traced contacts, ilan yung na-isolate mo within 24 hours also of identifying them. Because you see, meron pong equation na or may study na ginawa po ang mga eksperto natin, pinakita nila yung delays natin sa
Yes.
pag-isolate ng isang individual, no? So it ranges from 5 to 9 days kasi nakaranas ka ng simptomas, tapos nung hindi ka nagpa-test agad, pag nag-test naman, aantayin ng resulta. Pag lumabas na yung resulta, meron pang another 2 days lag bago ka ma-isolate. So this a total of 9 days in average would really give you that transmission kapag yung siyam na araw na nakakalat pa rin o nasa labas pa rin yung ating mga kababayan na may mga sakit.
Okay. Ma'am, kumustahin ka lang po. I mean, as part of our overall ecosystem and infrastructure for public health, sa manpower po, kinukumusta natin to for the past weeks already, particularly sa nurses. Last week, we talked to Mayor Vico Soto of Pasig. Sinabi niya nga walang tigil yung emergency hiring nila. And a lot of LGUs saying, notwithstanding that, hindi pa rin nila mapunuan. The Private Hospitals Association of the Philippines saying the same thing. Kamusta na po ang sitwasyon natin sa manpower naman?
It's really a challenge right now, no? So as much as we want to expand the units in our hospitals, we need healthcare workers for us to man this expanded unit. So ito pong emergency hiring natin, hindi po ito tumigil mula pa nung isang taon. Ang pondo po patuloy dyan. Tayo po ay continuously hiring, and for now, we have 7,000 plus na talagang kasama na dyan sa emergency hiring. Ngunit kulang pa rin po talaga dahil nagkakasakit ang mga healthcare workers natin sa ngayon. So ang napag-usapan po sa IATF, nagbigay po ng kaukulang suporta ang ating AFP, PNP uniformed personnel, yung mga reservist nila ay ngayon minomobilize nila para papuntahin dito sa NCR, makatulong po sa ating mga ospital. Aside from that, we have downloaded funds to our different hospitals so that they can also be able to hire on their own. Para parallel po yung effort, hindi po tayo nag-waste ng time para makakuha ng ibang mga healthcare workers that they need.
Mama, balik lang po ako dun sa vaccination. No? Gaano po ba talaga ang itutulong ng being vaccinated? Gayong nakakarinig po kami ng mga kaso ng mga nagka-COVID na at nagko-COVID ulit. No? Kabilang na po dyan si Mayor Joy Balmonte na pangalawang beses na mag-positive. No? Ka-announce lang niya. So, ma'am, ang tanong lang po dyan is, so kahit marami nang nabakunahan, wala pong guarantee nga na sila ay hindi mahahawahan. Kung mahawahan po sila, hindi mo ba parang ano po epekto nun? Pangalawa, what role do the variants play in this issue? I mean, does it suggest in any way that the vaccines nga may not be working against the variants? I just wonder.
Yes, ma'am. No evidence as of yet right now that these variants are affecting our vaccines. And even if it will, if ever it will, the WHO still recommends that we continue vaccination for whatever efficacy or protection it may give in spite of the affectation because of the variants. Ituloy mo yung pagbabakuna, additional protection pa rin yan. Ngayon, ang mga kababayan natin needs to understand, sinabi naman talaga na ito pong mga bakuna na meron tayo ngayon globally, all of this, hindi po sila nakaka-block ng transmission. So even if were able to be vaccinated already, nandun pa rin po yung chance that you'll get sick. Pero ang pangako ng mga bakunang to, base sa mga pinag-aralan at pag-aaral, ay sinabi niya na kapag kayo ay nagkasakit, yung chances that you will get severe infections, chances of you getting hospitalized, and chances of you dying ay bumababa ng sobra-sobra dahil mataas po ang efficacy ng mga bakuna laban dito sa ganitong klaseng sakit ng COVID-19. So you might get these diseases na mild lang, para ka nagkasipon, nagkaubo, pero yun pong pangamba mo na magkakaroon ka ng severe infections ay mababa na po, ang lesser chances ka. Ngayon, dun po sa mga nagkakasakit ngayon ng COVID-19 and they were vaccinated, most of these, we tried to analyze and there was this causality assessment done by our experts. At lumalabas naman po talaga na hindi naman po dahil sa bakuna ang pagkakasakit nila. This was because they were already exposed when they were vaccinated. That's why they developed the disease.
Now, Usec, pakilinaw lang po because lalong umiigting tong ivermectin na debate sa social media. A lot of people are starting to post about it. I think everybody's gotten messages both for and against, or at least just being cautious about it. Ano po ba talaga ang posisyon natin ngayon when it comes to the DOH and the FDA? Ano po sa ngayon ang advisory regarding ivermectin?
Well, the Food and Drug Administration has already issued an advisory weeks ago about ivermectin, and then they already reiterated, I think, within the day. Sinasabi po nila, dito sa Pilipinas, wala pa tayong rehistradong ivermectin for human use. What we have here are veterinary products. Meron pong kumakalat ngayon yung sinasabing 50 milligrams capsule, pero hindi po yan rehistrado ng Food and Drug Administration. At ano po ba sinasabi natin lagi? Kapag hindi rehistrado, hindi natin masisiguro yan na iyan ay magiging ligtas kayo at ito ay magbibigay sa inyo ng proteksyon na gusto nyo. Pangalawa po, pinag-aralan na po ang mga iba't ibang studies na ginawa abroad for ivermectin. Meron ho tayo yung grupo ng mga eksperto that we call Living CPG. Ito po yung nag-aaral ng mga iba't ibang mga treatment and management for COVID-19. And this, kasama po dito ang DOH, FDA at saka mga eksperto po sa iba't ibang larangan ng science. At sinabi na po nila, nagpalabas po sila ng posisyon. Sa ngayon, base sa lahat ng pag-aaral na meron ngayon for ivermectin, sinasabi niya, it doesn't give you any benefit dun po sa recovery na sinasabi, dun po sa sakit, makakapagpigil or makakapag-discharge ng mas maaga sa ospital, and all of these benefits that they claim. Wala pa hong sapat na ebidensya ang sinasabi. So ang sabi nila, sa ngayon, hindi pa natin yan mairerekomenda, owing to the fact that we also have to weigh the risk that it entails when you use this drug. Although generally safe siya, pero hindi pa rin ho natin sigurado dahil yung dose niya para sa mga hayop ay mababa lang. Pag ginamit sa individuals, yun yung sinasabi na experts natin, it might be a very high dose and it can cause something harmful for the body kung hindi naman talaga indicated.
So why
Ma'am, a while
even
ago
give
you
it?
were talking about the need for step-down facilities. Oh,
No, go ahead.
Ma'am, a while ago you were talking about the need for step-down facilities to move the mild and asymptomatic cases out of the hospitals. I was wondering how that's going kasi the last time we talked to the private hospitals president, si Dr. Rene De Grano, he was saying 98% ng mga kaso sa kanilang mga ospital are mild to asymptomatic na kailangan lamang paracetamol at cough syrup. At nahirapan daw silang ilabas itong mga ito dahil nandun na. So we're wondering how that's going.
Yes, tama po yan, sir. No? When we did our assessment also, we made the rounds of our hospitals here in NCR. Talagang yan po ang nakikita natin, yung mga mild and asymptomatic po, almost 50% of those admitted are this type of patients. So paano po ba natin yan gagawa ng paraan? Una, kailangan natin ng step-down care facility. So meron po tayong mga tinatalaga ngayon na step-down care facilities. Gumagawa po ang ating DPWH through the leadership of Secretary Villar ng mga additional units para po pwede nating gamitin for this. Another thing would be, pinag-iigting po natin ngayon ang triaging. So we encourage our local government governments na sana sila rin magkaroon na ng triaging doon sa local governments pa lang para hindi na dumidiretso sa ospital ang mga kababayan nating nagpapanik kasi sila eh. Kaya diretso ng diretso sa ER, napupuno po tayo. But if we have this streamlined process from the local governments to our hospitals, and then we'll be able to further decongest our hospitals.
Di ba naging problema nyo na rin po yan noon? And you had to come up with a directive to hospitals to just, in a way, not admit or turn away those with mild symptoms only and bring them to a quarantine facility. Isn't that what's being, at least, isn't that what should be done now as well, right?
Ma'am. Yes, ma'am. That is really what should be done. And before, during the July and August, the program of Oplan Kalinga was done where our local governments helped us in identifying people who have mild and asymptomatic and put them in facilities like quarantine and isolation. And also in the hospitals, we did that. We extracted patients. We tried to request from them that they be transferred so that we can have more beds in the hospital. That is what we are doing right now. But for the long term, one of the things that we have discussed with local governments as well as in IATF would be that proposal that local governments also set up their incident command, where it would be that the patients, the traffic of patients will be managed from the local governments, triaging them, telling them where you are supposed to go if you go to the isolation facility or you go to the hospital, so that hospitals will not be burdened.
Speaking of which, ma'am, I mean, a lot of people are trying to monitor on their own. I think a lot of people understand, of course, pagka symptomatic sila, okay, you have to really start consulting a doctor, if not go to a hospital and magpa-triage ka doon para ano. But as they triage at home, a lot of the confusion is for people who are asymptomatic or at least na-contact trace sila ng mga kaibigan na sinabi, oh, ako, positive ako, and so on. And it's really getting confusing. Meron akong kilala, nagpa-test siya, nagpunta siya sa clinic, tapos sinabi, 5 days, 7 days ka na palang nagmo-monitor na wala kang symptoms. Umuwi ka na lang because it's too late. Yung isa naman sinabi, it's too early para magpunta dito. And so, is there an easy way, a refresher course for everyone? Is there an easy way to remember kailan ba ako magpapatest? Ilang araw ba dapat binibilang ko? At what point do I start counting from the time na sabihan ako ng kaibigan ko na nag-positive siya pero asymptomatic siya? Is there an easy way for us to remember all of these things?
Yes, sir. Actually, unang-una po, kailangan natin maintindihan. Pag tayo po ay na-expose, halimbawa ako po ay nagpositibo at ang na-expose si person A. Si person A, sasabihan ko siya agad-agad. So kailangan magbilang tayo yung individual na nag-positive 2 days before I turned positive or I had my symptoms. Yun po dapat ang umpisa para balikan natin kung sino yung mga nakasalamuhan natin. So for example, I turned positive today. I should have all of those people who I interacted with 2 days prior. I will inform them and they have to go on quarantine to observe themselves. Now, with regard to testing, kasi po, ang talaga namang based on scientific evidence, yung viral load ng isang tao, tumataas siya from the 5th to the 7th day of illness. So when you have maybe on the first day after you get exposed, baka magkaroon ka ng false result at hindi siya accurate. That's why we always recommend do it maybe 5th to the 7th day after you got exposed so that it will be more accurate for you. So kaya nga po kapag kayo ay halimbawa na identify na close contact, you can wait until those 5th to 7th day until you get your results or your test done. Pero ang akin pong nire-recommenda, kung talagang yung access to testing is not there, the mere fact that you will quarantine for 14 days and observe yourself is enough already and can cut the transmission.
Okay, yeah, that makes it clear. So dapat pala talagang mas better it's really better to wait until the 5th day, to test. And in the meantime, to just be quarantined. At least that's clear now. Kasi yun nga yung nalalabuan na marami doon eh. Kailan ba? Kailan ba dapat? So is there a need for a second test if you take it on the 5th and you're negative? Kasi ang rule pa rin po is, di ba, pag negative, you still have to quarantine Why is that?
Ma'am, the incubation period of the virus is 14 days. So, ibig sabihin po, halimbawa, i-test ko man kayo on the 5th day and you turn out negative, the symptoms might come out even on the 8th,
After,
the 10th, or the 11th. That's why it is very important that we complete the 14-day period so that we can cut transmission of the disease.
Okay.
Okay. Pero ma'am, di ba, well, sa bagay, not all cases are symptomatic or clearly symptomatic kasi some of them are mild symptoms lamang eh. So you still have that, I suppose, gray area that you have to watch out for.
That's right, sir. Actually, ngayon, ang active cases natin, 95% of them have mild symptoms, 2.5%
Mild symptoms.
are asymptomatic. No? So pag tinignan po natin yan, talagang marami sa ating mga kababayan na talagang nagmo-monitor ng kanilang mga sarili. Pero kailangan talaga kumpletohin ang 14 days na period para po tayo ay makapag-monitor. You know, we have this experience na marami po sa ating mga kababayan on the 10th, on the 11th day, lumalabas ang kanilang mga simptomas. So napaka-importante talaga that 14 days will be considered and it will be complied with.
okay.
Okay. Okay.
Thank you. Yes.
Okay, maraming salamat, Health Undersecretary and Spokesperson Maria Rosario Vergeire. Ma'am, thank you for joining us at ingat po.
Maraming salamat.
Salamat po.
Ma'am.
Maraming salamat po.
Salamat.
We'll just go into a break, so please stay with us.
Welcome back, the Chiefs. We are now in the final stage of our conversation, and now joining us is retired Major General Restituto Padilla, spokesperson for the National Task Force Against COVID-19. Good evening, General Padilla.
Good evening, Robbie, and good evening to all of you viewers who are following this program.
Okay, good evening, sir. Sir, upisa tayo, no? Sa NCR Plus bubble, ECQ starting today until April 4. Tama po ba?
Yes po, that's from kanina pong umaga, no? Nagsimula na. And then up to Sunday.
Okay, so standing po yan, April 4. Kasi may mga kumakalat na mga chismis na hanggang end of the month na raw po ito. Wala pa naman tayo nababalitaan na ganyan.
Wala naman pong official announcement. Kung ano po yung unang anunsyo, yun po ang mananatili. At tabayanan na lang po natin if there will be another announcement. So all of this will depend on our on the data that will be provided by our scientists and epidemiologists.
Sige po. So hindi po natin uunahan ng Malacanang.
Hindi po.
Sige. What now, is there any difference between ECQ now from ECQ nung ika nga ni Dr. Pogi nung season 1 last year?
Well, there's a madaming difference, no? There's a lot of easing na being done for this ECQ. Last year's ECQ was tighter, was much more stringent, and there were a lot of businesses that were disallowed from operating. Public transportation was not there. There were only a selected number of businesses, and essential personnel were allowed out. There was no exemption from curfews. Now, what we have is that deliveries, courier services, and food and transportation will be allowed to continue on even during the curfew, together with essential stores remaining open for most of the day, particularly those that are health-related. Yung sa manufacturing, health-related, pinapayagan din po yan. So, madami po that are being allowed compared to last year. At saka yung area po ng coverage, by the way, it's very different. It's only NCR Plus.
True. How was your first day of implementation? What particular guideline or protocol did people find most difficult to comply with? Halimbawa, to me, nakita ko dyan, nakakalimutan ng tao yung 6 p.m. na curfew, no? And there were, kanina sa news namin, there were still so many people outside of their homes at 6:30, no? Which says a lot also about, this whole protocol thing being a habit. We're forming new habits. How did you find it today?
Well, generally, it was very orderly from the morning up, and it was only during the implementation of the new curfew time, because this is the first time that the 6 o'clock curfew begins.
Yeah.
So last night, nagsimula tayo 10 o'clock ng gabi. So up to 5 o'clock. But today, because of the effectivity of the ECQ, the curfew now begins earlier at 6 p.m. But that does not necessarily say na bawal talagang lumabas yung mga tao. Kasi may mga apor pa po,
Yes.
those who are allowed to go to work, they are transitioning from office to their homes. They are allowed to move. So these people who essentially need to keep the economy going and to keep their business going and support others will be allowed to move from the place of their work to their places of residence.
Yun na nga po, marami pong nagrereklamo kanina na dahil pinapayagan naman po magtrabaho, ang problema nga po, kulang naman yung transport dahil pinaliit to 50% ang capacity ng mga PUV at pati mga private vehicles, di ba, hanggang 2 tao lang. So ang dami pong na-stranded kanina. Bakit nga po ba, at least in the case of the private vehicles, no, parang medyo mahigpit po yata yung 2 tao lang.
Sa mga shuttle, basta may 1 seat apart per DOTR's briefing yesterday. Sinabi naman po nila ang pampublikong sasakayan ay papayagang magtuloy-tuloy. The problem lang at madaming operator who decided to keep their drivers safe and did not fly the route anymore. So maybe DOTR will start addressing this in the next days to come. And
Yes,
perhaps
yeah.
there will be a slowdown once most work comes to a halt by Holy Wednesday onwards. So yun po rin yung timing. The experts from the IATF recommended that this might be the best time to put up the ECQ when businesses are actually coming to a halt for the Holy Week. And we have to go back to the real essence bakit tayo nag-ECQ. The real essence of an ECQ is to stop mobility, which is the primary source of the transmission. So I'm not an expert, I'm not an epidemiologist, but from what we hear from our experts and what they brief us is that if we are able to control the mobility of people, the passing on rate of the disease will be controlled kasi nagkakaroon po ng lesser contact sa mga tao. So essentially, that's why may call tayo sa lahat, may panawagan sa lahat na manatili sa bahay.
So, but sir, what about on the other
General,
side of that equation?
just
I
for
mean,
some
kasi one side of it, as you said, is yung panawagan sa mga tao wag lumabas. But the other side of it is providing more transportation options for those who really have to go out. Ano po, nabanggit niya nga po, DOTR hopefully has something. Would you know what are some of the options that are being discussed para dumami yung capacity ng mass transport?
But wala na po tayo magagawa sa 50% capacity. That is the safest para sa lahat. Tulad ngayon, nabalita na naman po na MRT its tellers, several of them have been positive for COVID. So upang mapangalagaan yung pampublikong kalusugan, pati na sa mananakay, they have to maintain these capacities to ensure the transmission is controlled. Now, what can we do? If I remember right, DOTR in a call to the public yesterday encouraged everyone to again go back to the use of their own vehicles or the use of bicycles and whatever means of personal transport para wala hong contact pag sila ay nagta-transition galing sa kanilang tirahan at sa trabaho. Pero kung hindi po kayang gawin yan, yung pampublikong sakayan ang magbibigay ng lunas sa kanilang pangangailangan na makarating. So, ipapaalam po natin ito sa DOTR and then hopefully we can provide augmentation if ever there's a need.
So hindi mo pwedeng
General,
magdagdag na lang.
just for some clarity.
Go ahead,
Yeah,
Ed.
just for some clarity, kasi
Ed,
it is
go
Holy
ahead.
Week. It is Holy Week, and it's the holiest time for Christians this year. Just some clarity, kasi the IATF nga says that bawal ang religious gatherings. Pero for example, in the case of Quiapo Church, they're not allowed to attend masses nga but the church is open and up to 50 people are allowed inside. So we're trying to figure out kung ano talaga yung parameters dun sa religious gatherings versus being inside a church, for example. Ano yung bawal, ano hindi pwede.
Again, babalik ako, Ed, dun sa real essence, bakit tayo nag-declare ng ECQ, no? To reduce mobility ng mga tao. So, as far as religious services are concerned, nagkasundo na po yata ang liderato ng mga simbahan at karamihan ng mga simbahan online na po ang kanilang gagawing services for the Holy Week. Now, for many of our citizens, yung mga kababayan natin na nais dumaan pa rin sa simbahan, sila po yung nagdagdasaan sa mga simbahan at nag-a-attend ng serbisyo kung maaari sila mag-attend. Pero pinag-usapan na nga po na manatili muna sa bahay kung hindi naman kinakailangan nasa labas at yung mga services na kinakailangan gawin sa simbahan, attendan na lang po online. So yung pagpasok kanina sa Quiapo, na-address kanina yata yan, hindi na pinayagan pumasok yung mga ibang mga kababayan natin. At yung services ay patuloy online.
Sir, paano po yung
Yes, sir.
ano?
No, sir,
Yung
we understand the services po. Pag services, ganon. Pag services po, ganon, hindi dapat mag-attend. Pero for example, people are allowed still in Catholic Church, for example, people are allowed to stay inside up to 50 people. Not for services, but for them to be inside the church lang, to do what they want, whether it's to pray or to do the stations of the cross. Kaya I'm wondering lang kung ano yung parameters talaga. Ano yung pagkasunod talaga in detail. Kasi kahit pa paano, very general pa yung napagkasundoan na no religious gatherings eh. Pero the details, of course, that's where the devil is eh.
So when you go to church, do you talk to somebody? Do you remove your mask? Do you remove your face shield? Pagkadadaan ka lang para magkaroon ng personal visit? Siguro naman hindi, ano? So you just go to a corner away from the number of people who are also there if they are allowed to come in and pay a visit. They kneel down to pray in the pew. Malayo sila sa mga tao. So ano ba possibility ng transmission doon? So mababa, di ba? Kaya siguro yung mga iba nagpapayag lang para lang yung faith nila, yung pananampalataya nila at yung pagkakataon nila na makabisita sa Blessed Sacrament, makapagdasal ng sandali at manatili sa simbahan for reflective thought, lalo na ngayon Holy Week, ay pinapayagan. Pero ang essence nun yung sinasabi natin na transmission. Kasi sa services, kumakanta, nagkakaroon ng sharing kung minsan. So, yun ho ang inawasan. Ngayon, yung personal visits, napakaliwanag. Kung wala kayong kausap, wala kayong katabi, malayo po yung mga ibang tao, siguro naman pwede naman nating payagan na manampalataya at magdasal yung mga tao.
Sir, let's talk about the contact tracing enforcements, no? Kasi I understand na you're now even conducting house to house or bahay-bahay na inspection, no? At paano nyo matutuntun kung nasaan yung mga taong dapat ma-inspection? How do you do that? How do you go about doing that?
So again, I disclaimer lang, I'm not an expert, I'm not the epidemiologist, but from what we're doing at the NTF, the surveillance needs to be done because we're fighting an invisible enemy. Hindi po natin nakita ang kalaban. So paano po nalalaman kung nasan yung kalaban? So ang ginagawa po dyan ay alinsunod dun sa strategy na in-implement natin nakaraang taon. Ano po ba yung strategy na yon? Ang tawag po doon ay PDITR. Yung P ay preventive, yan yung patuloy na pagpapaalala na dapat gawin ng mga minimum health protocols. Yung D, yun yung detect. Doon yung pumapasok yung testing. Doon natin nalalaman at doon natin natutukoy kung nasan yung kalaban, kung nasan yung virus. So, yung patuloy na surveillance na ginagawa sa pagbisita ng ating mga health experts, mga ating health workers, yung ginagawa nila testing ng mga komunidad kung saan mataas yung mga rate, ay isang bagay na dapat pinatutupad upang matukoy kung nasan yung sakit. Kaya doon nalalaman na ang isang pamilya pala ay halos lahat sila infected na hindi pa nalalaman dahil karamihan sa kanila asymptomatic. So, nagkakataon yung ilan na walang sakit, yun na lang yung inilalabas para dalhin sa isolation kasi karamihan na sa bahay ay meron ng COVID. So, nagkaroon ng reverse isolation. So, this is the detect phase, no? And isolation now happens once you are able to pinpoint where the virus carriers or those who are sick are. So they are isolated and they are kept in facilities where they will not be able to transmit it to others. And then treatment goes on if they need to be treated. And then if they're well, they're reintegrated. So that's the PDITR, which is now being reinforced in all areas, same as what we did last year.
I wonder if
General
there's a lot of resistance against it. I mean, are you encountering resistance, or are people now more willing to actually join you or submit to you? Kasi I've heard of stories nga na, syempre, ang sama ng loob nila na talaga they're literally being torn away. That's the word, no, from their home.
Alam niyo po, ang pinakamalaki at pinakamabigat na dinadala ng COVID ay yung mental anxiety, yung pagkakaroon ng takot. So, wag po tayong takot. Yun naman pong ginagawa ng ating mga LGUs, mga health workers natin, ay para sa kabutihan po ng lahat, para hindi nyo ma-infect yung mga mahal nyo sa buhay at maiwasan pa yung pagkalat ng sakit. Kasi what we're trying to do right now is bring down the COVID cases that are continuously shooting up. So, 10,000 na po tayo ngayong araw, kung hindi ako nagkakamali, sa report ng ating DOH. So, in order to get that number down, we need to do these measures and we need to remind people. Kasi pumasok na po tayo sa tinatawag na pandemic fatigue. Siguro napagod na yung iba sa kakakomply sa minimum health standards. Pero hindi po tayo kailangan bumitiw eh. Hindi po tayo pwede pang bumitiw hanggat hindi po tayo nakakarating dun sa level na yung transmission kontrolado at wala na. Kasi ang punto na talagang iniiwasan natin ay nadagan pa yung mga namamatay.
General, speaking of fatigue, part po ng fatigue, it's not really fatigue, but part of what's pushing against really the best behaviors, including staying at home, of course, is the pressure for people to work. Now, ECQ ends April 4. People will be raring to go back. And to counter that, dyan po mahalaga yung usapin ng ayuda. Now, spokesman Harry Roque has already said by mid-April, hopefully nandiyan na, na-release na yung ayuda. But that might be too late for a lot of people. Ano po ba yung update natin sa ayuda, if not in terms of guaranteed timelines or if not in terms of actual figures that people can expect? Meron po ba tayong clearer timeline on when people might expect yung mga ayuda nila?
Ang ayuda po ngayon ay bababa na sa LGU para mapabilis. So there was an announcement galing po sa DBM natin na yung mga pag-release ng pondo ay bibilisan. So mientras na nagawa na po yan at nakarating na po sa LGU, bibilisan na po ang pag-distribute. At hopefully, pati yung LGU, pag hindi pa man nila nakuha yung ayuda, may mga maibigay sila mga food packs para bilang tulong sa ating mga kababayan. So, madami tayong natutuhan noong nakaraang taon. And hopefully, the lessons that we have learned previously can now be remedied to make it faster and help more people.
So this is not contingent naman on the ECQ being extended, is it? I mean, pagka hindi bibigay pa rin yung ayudang yan kahit na hindi ma-extend ang ECQ, ganun po ba yun?
Opo, entitled naman po yung mga kababayan natin na manatili sa bahay dahil huminto sila sa pagtatrabaho at kinailangan nila yung tulong. So I guess that LGU will continue to provide it or the DSW will continue to give it.
Gerald, I don't know if this has been asked already, but there was a proposal kasi, or there's an idea that there will be house visits to ferret out those who are symptomatic. I don't know how serious that proposal was. I asked about that kasi as it turns out, malit lang yung percentage talaga ng mga clearly symptomatic cases. Baka a lot of effort is going to be put into doing a house and with very little results. Kasi if I remember right, mga 93% lamang yung may nagpapakita ng clear symptoms. I'm sorry, 93% ang walang clear symptoms. Ang may clear symptoms, nasa 3% lang siguro or less eh.
Mild. Yun na nga yung nakakatakot, Ed, kasi kung marami na asymptomatic o walang symptoms na pinapakita pero they carry the virus and they think they are not sick and they get to mix up with other people and they're not very careful about their compliance to the minimum health standard, then we get this virus circulating again. So what will happen is we will realize the experts forecast that our increase in cases might become exponential. It might be too late to reverse it. That's why it so happened that this being the Holy Week, it was a perfect time to go to a standstill and help our frontliners and workers get that number down so that they are not overwhelmed.
Alright. Okay. Maraming salamat po sa inyo, Major General Restituto Padilla of the National Task Force on COVID. All right. Thank you,
salamat
sir.
din po. Maraming salamat din po.
Maraming salamat po.
Let us all stay safe. Okay, salamat po. Thank you.
All right. Okay. Ang haba ng delay
for
mo,
this Holy Monday edition. Okay. Okay. Everybody's online. What can I do?
Yeah. Okay.
Traffic ngayon online, kala nyo.
Okay.
Anyway, that'll be all for this Holy Monday edition of the Chiefs. We hope to discuss here will keep the conversation going. Remember, mask on, wash hands, and stay safe, Philippines. I'm Edwin Gao.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.